Much. We're now going to move to a panel discussion of the issue and also the McKinsey report. And it's my pleasure to introduce my friend Matt Miller, who is a senior fellow at the Center for American Progress. Matt is going to moderate the panel and introduce the panelists. But first, let me say a few things about Matt Miller. Matt is an author, a columnist, a radio host, and a consultant whose work focuses on agenda-setting ideas and creative problem solving in the public, private, and nonprofit sectors. But I have to say that Matt's also a celebrity in a celebrity-driven culture. But he's also a celebrity who is able to think broadly and deeply without ideological or partisan constraints. Now, why do I say he's a celebrity? Well, he has a new book out. It came out last week. Is that right, Matt? It's his second book. It's called The Tyranny of Dead Ideas, and I believe he released it on the Stephen Colbert Show. It's not an especially funny book, but it is a book that all of you have to read. The Tyranny of Dead Ideas is a book about the threat that individuals, companies, and in fact the entire country face from the things that we think we know, and about the new and surprising ways of thinking that are destined to replace these dead ideas so that the country can prosper. I would commend to you Chapter 3, which is all about healthcare. And thank you for the kind words you said about CED in the chapter, which I didn't know about until the book was final. Matt is also as I said, a senior fellow at the Center for American Progress. He's a monthly columnist for Fortune, an award-winning contributor to the New York Times Magazine, the Atlantic Monthly, and other national magazines. He hosts a radio program in Los Angeles, Left, Right, and Center. It's a political week in review program that is also aired on public radio stations all around the country. Let me plug his first book, too, because that's worth reading as well. It's called The 2% Solution: Fixing America's Problems in Ways Liberals and Conservatives Can't Love. It came out by Public Affairs in 2003. He's worked at the Office of Management and Budget, senior advisor to McKinsey. He's a member of the Council of Foreign Relations and also the Screen Actors Guild. Cameo appearance in a movie, a thriller called The Siege. So he is a celebrity. I can tell all of the CED trustees here that you will next week receive a free copy of the book. We'll be getting 200 copies, and everyone here today who is not a CED trustee but who is getting a free lunch, I would urge you to buy this book, to buy Matt's book, and more importantly, to read it. It is absolutely outstanding. So please welcome my friend and a very good friend to CED, Matt Miller.
That's really... thank you. I don't even know what to say. Thank you, Charlie, for that. My publisher thanks you, and we'll be talking to you more later. That was just, it was unbidden and probably too much for what people really wanted to hear, for at least about that book. So I'm delighted to be with CED, and CED, under Charlie's leadership, has done so much to try and push the healthcare debate to the front of the national agenda, and it's exciting to be with a room full of people who have spent the morning, as business, labor, as the think tank community, as healthcare stakeholders, coming together to try and help make the world safe for our leaders to finally act on something that we all know is overdue and really urgent for the country at this hour. I'm, as a veteran of the Clinton health reform plan, I worked at OMB in '93 and '94. I know how hard this is, and I know we didn't do it right in the end last time. And the lessons that have been learned in the 15 years since, I think, have created a real ripeness at this point, and in particular, a chance to transcend what I think are always the two fundamental problems that end up stalling progress. So these kind of two immutable principles. One is that every dollar of healthcare waste, and we just heard Lenny talk eloquently about how much waste there is in the system compared to other countries and how it's all across the system, but every dollar of healthcare waste is somebody's dollar of income. That's the sort of fixed political problem that our leaders have to find a way with our help to transcend. And second, every time we have a healthcare reform debate, everybody comes to the table, every interest group, with a plan A for reform, and everybody's plan B is the status quo. And these are the kind of, by this time, cliched problems that plague us. And I think with groups like this, in this audience and elsewhere coming together, we finally have a chance to move past this. So we have a great panel that can help illuminate from some different angles of vision what their different approaches are at this point, both in reaction to some of the stunning facts that Lenny shared and from their own authoritative perspectives as stakeholders in the system. Why don't I ask everybody to come up, arise now, those who are on the panel, and just come up because we have a lot of ground to cover. And what I'd like to do is offer a kind of brief introduction quickly of everyone so you'll know who's here. And then what we're going to do then is hear about 4 or 5 minutes from everyone down the line on their perspectives. There'll also be one guest who's joining by video who couldn't make it in person today. And after we hear 5 minutes from everyone, what we'll do is I'll tease it out with a couple of quick questions, but then we'll have time for Q&A with this distinguished audience. So without further ado, let me start immediately to my right is Carl Camden, who's president and CEO of Kelly Services, Inc., which is a Fortune 500 company headquartered in Troy, Michigan. Carl's a member of the Better Healthcare Together Coalition and also a trustee of CED. He served on the Labor Advisory Council of the Federal Reserve Bank of Chicago for the last 10 years or so, and he's been on the advisory committee of, the ERISA Advisory Council some years earlier. I think you all know what Kelly Services does. There's more in your materials on it, but a big welcome to you, Carl Camden. Thanks for being here. Next is Nicholas Wolter, Dr. Nicholas Wolter, who's the CEO of the Billings Clinic, based in Billings, Montana. Dr. Wolter leads a fully integrated health system in the northern Intermountain Rocky Mountain states. Billings Clinic is a charitable, tax-exempt medical foundation, employs over 3,000 people. The clinic provides physician clinic services in multiple rural sites and also manages 7 rural critical access hospitals. It's also one of 6 equity members of a statewide HMO, New West Health Services. And Dr. Wolter is also a member of a number of the distinguished boards and panels across the healthcare sector. And he was recognized by the Medical Group Management Association as Physician Executive of the Year. Welcome to you, Dr. Wolter. Next to Dr. Wolter is my friend Lois Quam, who's the managing director at Piper Jaffray. She's head of strategic investing, green economy, and healthcare at Piper Jaffray, which is a newly created senior post responsible for the development of new business opportunities in the emerging green economy and healthcare sectors. Lois is a former executive from United Healthcare Group. She chaired the Minnesota Healthcare Access Commission that made the case for new legislation that brought health insurance to tens of thousands of Minnesota's, which really brought down the uninsured rate in that state to the lowest in the country. She also was an advisor to Mrs. Clinton's task force on health care reform. Some years back, she's testified a lot before the Senate and Finance Committee, and in addition, she's appeared 3 times on Fortune's list of the most powerful women in America, so we've got lots of powerful women in the room. So welcome to you, Lois. Next, and this will be by video, so why don't I introduce our video person when we go to that so you won't get confused. But next on our panel is Patricia Gabow. Am I saying that right? Gabo, I apologize. MD, Patricia Gabow, who's CEO of Denver Health, which is a highly integrated public health care system. It's the principal safety net institution for Denver and Colorado. Dr. Gabow joined the staff of Denver Health and Hospitals in 1973. In 1981, she became director of the medical service and then has risen until her point of total domination now at Denver Health and the Denver healthcare area. She's also a professor of medicine at the University of Colorado and author of 150 articles and book chapters in numerous professional societies, including the Association of American Physicians. She's been named one of the top 25 women in healthcare, one of the top 50 physician executives, and one of the 100 most powerful people in American healthcare. The power is oozing from this panel, which is great. So without further ado, and I'll introduce our video guest when that moment comes, let's have a quick 4 or 5 minutes from each, and Carl Camden will start.